I'm with Dr. Teresa Frankovich. It's April 10th, and this is the media availability. What does treatment look like for those with COVID-19?
Well, primarily it has been supportive treatment, so it's providing people with the oxygen, for instance, they need, ventilation if they need it, and then sort of those general medical support kind of services. Going forward, of course, we're exploring all kinds of things in terms of treatment, from anti-malarial medications to antiviral medications, as well as looking at the possibility down the road of using immunoglobulins, so antibodies from people who have recovered, as a means of treatment. So, lots of important research is being done, and generally the best idea has been doing that according to protocols and often in conjunction with, as I said, research sort of efforts.
Why is information coming from our federal administration contradictory to what is being seen on the ground, such as the president suggesting that widespread testing is no longer a problem and that, quote, anyone who needs a test gets a test, they're available? Is that true?
Well, I can tell you that's been a frustration, certainly on my end, and I can say that that's echoed among health officers in our state as well as across the country, because on the front lines, it is not our experience that is unlimited. And what we actually find is that there are multiple limitations in this process. Part of that goes to even the basic things like swabs, to be able to collect the specimens through the reagents used to do the testing, and then the laboratory capacity to do as much as we need. So we face that on many fronts, and that's why most areas are having to heavily prioritize the specimens that they test. I've certainly been in contact, as have others, with our local representatives, as well as representatives in Washington, about the needs that we have and trying to address these obstacles.
Chipotle and Eureka opened for business yesterday, drawing large crowds and several people in close proximity to one another. Did that present a risk or danger to the public, and does public health have the authority to shut down a food facility for non-compliance of the order?
So I think the order is very specific about restaurants and what they should be doing, and certainly language in there about doing social distancing to the maximum extent possible. And we expect that because it ultimately is a safety issue for all of our restaurants. And so I think in general our approach has been educational rather than punitive in these instances, but there certainly are enforcement options for entities that are not adhering to the policies and orders that we have put in place.
I know you've addressed this prior, but there seems to be some public confusion. Can you please explain the difference between quarantine and isolation?
I know, it's very confusing, and it's one of those terms that quite honestly, even in public health at times, as we're just sort of generally talking, we sort of interchange them, and that's unfortunate. So they're very specific. Isolation, by definition, is an individual who has symptoms. They either are confirmed, we use that term to have people maintain at home, if they are a confirmed case, or if they are a probable case, or if there's someone who has symptoms and is awaiting a test result. All of those individuals are symptomatic, and their movement is restricted by an isolation order. For individuals who are in quarantine, those are individuals who are not symptomatic. They're well, but they've been exposed closely to a case. And those individuals are also asked to remain at home. They receive quarantine orders, and the effort, of course, is to keep them out of circulation in the public until we establish that they are not going to develop COVID. And that generally is a period of 14 days.
Okay. Can you tell us, of Humboldt County's 50 positive tests, how many were processed at the Public Health Laboratory and how many at Quest and LabCorp?
Well, honestly, I don't know exact count off the top of my head. What I would say is, my guess is that probably less than a handful of those are commercial laboratories, certainly not a large number of them. The bulk of them were positive tests at our laboratory.
Okay. It seems like the rate of local test results from private labs has slowed considerably in recent days. Do you know if that's because of a backlog or fewer samples being sent for testing?
Well, it's a good question. We've observed that here at Public Health as well. And I think there's, you're right, there's a couple different possibilities. One is that we're just not getting results as quickly from those labs. Our experience, we've had results sometimes, within 3 days from those labs. Some people are experiencing delays of 7 to 10 days. So we are really watching that carefully. We're constantly in that system looking for new labs. So we'll see. If we suddenly get a glut of them in the system, we'll know that there's just been this delay. There also is a possibility that right now, because we've headed out of flu season primarily, and as we all know, this time of year, generally we start to see people healthier. They're not getting all the respiratory illnesses we normally get during the winter. That we may be just seeing a decline in people overall with presenting to their providers with respiratory symptoms that are consistent with COVID. And so the providers are not triggering to test those individuals. They're just not seeing them right now. So if that's the case, what we would expect is as we move forward, since again, we'll be in a low cold and flu season, people coming in with those symptoms will become increasingly likely to be positive for COVID.
Okay, I think you've just answered this question, but in general, it seems like there's very little testing being done. Why is that?
Well, I would say today we ran 55 specimens. So, we consider that pretty much at our capacity on most days runs. So, I think it varies a little bit day to day, but overall, again, we've certainly seen this with the commercial laboratories, and I'll keep people posted as we discover what that reason is.
Okay, thank you. It seems that the number of test kits available to the public health lab has been diminishing. Do you have prospects of acquiring more kits, and where will those come from?
So we are constantly in a position of working to acquire more kits because we're using them on an ongoing basis, obviously. And so we've been adjusting those numbers just to show people that, our current supplies go down as we do this testing. And then we will tweak that back up when we get additional supplies in the door. So right now I think we just got some additional things in the last day. So every bit that we get in helps. And again, we are still pursuing reagents for some of the other equipment we have on site that would help us increase our testing capacity. And we voice those concerns to the state as well as our representatives and such too, because a loosening in that supply chain would help us a great deal.
Excellent. Of all the cases, why haven't we seen more people recovering from COVID-19, and how does public health make that determination?
Well, it's another really good question. Part of the problem here is that as you look from county to county or even across the country, even on the Hopkins site, the Worldometer site that a lot of people look at for this, this recovery column is really hard to interpret. And it's because there hasn't been a really universal definition of what that means. Does that mean when someone is completely free of symptoms after COVID? Does that mean that they're a certain number of days out from COVID? Does it mean that they've been removed from isolation? And that's the definition. So we've actually been asking for guidance along with a lot of other areas from state public health and such to sort of have a uniform definition for that so that we can all report in the same way and it becomes much more meaningful to look from area to area about outcomes. So it is not that people haven't recovered. I'm hesitant to put that number out there until we can really have some consistency about what that number means.
Are people being tested a second time to make sure that they are potentially recovered from COVID?
Well, actually, the CDC provides guidance for 2 ways to clear somebody in terms of COVID. And that by clear, I mean take them out of isolation. So one way is to have them meet certain symptom criteria as well as have 2 negative tests 24 hours apart. Another way is to clear them based on clinical criteria and sort of the length of their course, the absence of fever for a certain amount of time, and a generalized improvement in symptoms. So overall, people are using the clearance based on clinical symptoms in almost all situations, partly because we're trying to preserve testing capacity to meet those needs of identifying new cases. And so that standard exists out there. We use that. There are some instances in which we look at it on a case-by-case basis, but overall, most individuals are cleared based on symptoms.
Okay. If a citizen has feedback on what the county considers an essential or allowable business, what should that person do? And does the county continue to refine what is allowable and what is not?
Well, I think new questions emerge all the time. It's impossible in a single document to outline every possible business out in the community. So that's why our Joint Information Center, I think, has been helpful. People can go to 441-5000 if they have questions about that and get some additional information that can help them determine whether they fit the bill.
Okay. Can you explain the limitations and what the data from testing can tell us in terms of how many people are infected in our community?
Well, that actually goes right back to our testing question, right? So the issue is the more we can test, the more we can detect. And so the capacity of the system to take additional specimens really helps us determine that. So I can tell you, because we've identified community transmission cases, that we do have COVID circulating in our community. At this point, it may be in relatively low levels, and that's been helped by the fact that we have had shelter in place, and because people are social distancing and limiting their movements outside their own home, as well as decreasing their interactions with people who live outside their home. That's critically important because individuals who are asymptomatic, we've been able to demonstrate, can spread this infection. And so it doesn't have to be intentional on someone's part to expose other individuals. But the minute we bring individuals who do not normally live inside the home and mix those individuals, you bring in that possibility of additional exposures. So again, it's a perfect time to just remind people heading into the holiday weekend as well as the Passover holiday that we really need to adhere to this guidance, and not as much as we would like to gather individuals together, because it really does introduce risk for everyone.
Okay. Time Standard Managing Editor Mark Bowles sent in a long question which you read beforehand. And can you please paraphrase the question and then answer it for us?
Well, I think the question really went to this issue of surge and modeling, and how do we know that we have not hit surge without models. And so a couple things I would say about that are that surge, the term we use for surge essentially refers to sort of that fast increase in number of cases that brings us to a peak. And again, when we talk about preparing for surge, we're talking about that rapid influx of cases that may challenge our capacity at the local level to provide care. So surge, I can tell you that we have not hit surge because in relative terms, and when you look at New York and San Francisco and other areas of the country, and even in smaller rural areas, we have not hit the kind of caseload that we would term surge. And I can only say that when we hit that steep incline of cases, we'll all know that. And we'll certainly be communicating about that when it appears to be really upon us, or we're seeing that trend. Modeling is helpful in terms of planning purposes right out of the gate to try and say, you know, how is this likely to unfold? When is it likely to occur? How many people are we talking about? How do we actually determine how many more beds and ventilators and all those things we need? There are multiple formulas to do this, and all I can tell you is that when you're first starting with something like this, there's not a whole lot of meaning to these models, because there are so many points that you have to insert of subjective data into the model that you do not have even good guesses on, that the model itself does not really provide a lot of assistance, certainly to the public, in terms of planning and understanding how this is going to unfold. So we take these sort of crude estimates at the beginning, we sort of plan contingencies, and then those estimates are just constantly refined as things evolve across the country and across our local areas. So what I can tell you is right now, my understanding is that the state is working on modeling for counties as well, and I'm hoping to see that soon. We have not yet received that. And what will be helpful about that is they will be basing that, I assume, on the experience that we're seeing in California. And so it will be timely, and it will reflect what we've been seeing in very recent days with this, in recent weeks. And I think it will give us a little more solid footing about planning as we go forward. All we can do in the interim is sort of make some really, some projections based on, for instance, other countries and things like that, and just try and make sure that we're meeting worst case scenarios, if at all possible, in terms of our planning. But, I understand people's desire to have some sense of how this is going to happen on a timeline, And I think, as soon as we have some understanding of that that's meaningful, we will be happy to share that information. It's not something I'm trying to guard, but right now there's just nothing that's really quality for me to report that people can really use in a meaningful way.
Excellent. Thank you so much, Dr. Frankovich.
Thank you.